Hello, we're here with Stride Community Health Center's Chief Healthcare Officer, Dr. Savita Ginde. Dr. Ginde, can you tell us just what your life has been like with the COVID-19 crisis? What does your day-to-day look like these days?
Sure. The past several weeks have been quite crazy, trying to anticipate the needs of the community and the people of Colorado, especially in the regions that we serve, as well as trying to maintain staff health and protecting our staff to be able to continue to provide services to patients, while also trying to sort of manage and figure out and navigate everything COVID. So it's been kind of a whirlwind, working with both CDPHE as well as local hospitals and larger entities to make sure that we find the right place amidst this current pandemic, help to reduce some of the burden on the hospitals while also being able to stay open and again to serve those patients who need us.
Are you seeing what the rest of the country is seeing, starting to get sort of overburdened in our healthcare system? Can you kind of put us into that reality?
Sure. A couple of the steps that we had to take from an immediate action standpoint at Stride was that we looked at our 18 existing health centers and quickly consolidated as much as we could so that we didn't have to expend more PPE than we had, so that we could consolidate resources. And so we are now standing at 7 open health centers rather than what we normally have open when we're not in crisis or pandemic mode. The other thing we've had to do is start looking at making sure that the employees were screened and that we had proper door screening as well, so that any patients that were coming in were evaluated before they were even in the health center. And we set up COVID testing. So we are one of the few community health centers in Colorado who is providing COVID testing on site. We have had to qualify people to get a COVID swab only because the swabbing kits themselves are in ration alongside PPE. And so we can't do all of the testing that the state or anyone would really want to do because we can't get enough of those kits, just like we can't get enough of the PPE. So just trying to be very efficient with our healthcare delivery, trying to keep our staff healthy so that they can continue to provide services to those who need it. And again, finding our space in this pandemic to bridge people from not having to go to the hospital, letting the hospitals really focus on the people who are really, really sick, and our role in getting people either tested or helping them with just supportive care so they don't get worse.
Your specialty, I think, throughout your career has always been women's health, and I'd love to explore what this pandemic means to women specifically. Are there issues surrounding family planning or being pregnant or getting pregnant with the risk of this virus out there that people should know about?
So there's a couple different things in regards to family planning and reproductive health with the COVID-19 virus. First of all, a lot more people are at home. They should be at home on social isolation. And so I think it's super important for women to just be prepared with either emergency contraception and or having their routine and regular birth control teed up so that if they are not looking to get pregnant, and that might just be one of the activities that they do while they're home, that they are putting some forethought into that and having some control over their plans. Secondly, I think that COVID-19 and pregnancy is something that is still being evaluated, but right now we consider anyone who is pregnant just high risk. And so in our system, we have tried to get any pregnant providers and staff that we had home so that they can be safe. I know that some of the OBGYNs in town have also taken some huge steps to make sure that people who are currently pregnant are safe and make their level best effort to not get the virus, because we don't have a whole lot of information about the impact on the pregnant female or her pregnancy itself.
Are pregnant women considered to be immunity compromised or immune compromised?
They are more immune compromised than someone who is not pregnant. And of course, any other medical conditions that they might have could contribute to how they might experience COVID-19 if they were to get infected, let alone not having a whole lot of data about how COVID-19 might affect their baby.
And are you seeing any issues related to access to care or abortion services, anything like that women should be aware of?
Yes. So very recently in the state of Colorado, we know that our governor asked that all elective procedures be set aside. And of course, abortion is a medically necessary procedure, and therefore those services have not stopped. Obviously, if they did, they would make an immense impact on women being able to access, because we might be in this position for weeks. That might put people beyond the gestational limit for being able to access services, or it might just put them into a bind in terms of they themselves being able to be able to find access to those services themselves. So I think that's something that's important. I know a lot of the abortion providers in town have created telehealth opportunities for patients to be able to access abortion care through telehealth as much as they can. So I think we've been able to leverage technology to help us in the current pandemic situation.
Anything else that you would like to leave with us, particularly as it relates to women and COVID-19? Any other pieces of advice that you think you'd like to get the word out about?
Yeah, I think the most important thing is to try and stay healthy and happy. I know it's tough to be stuck at home. And I know a lot of people have their kids at home and they're trying to figure out what to do with them and how to keep everybody busy and sane at the same time, but staying healthy, making sure that you're washing your hands frequently, wipe off your cell phone as well, make sure that that stays clean, make sure that you're all doing some type of activity in the house, whether it's dance parties or we've done relay races down the driveway, and just things to kind of keep people moving, and getting adequate sleep and everything that's important to your health, I think is super important at this time.
Well, great. Dr. Ginde, thank you for sharing your wisdom. We appreciate it.
Yeah, thank you.